Hi, I'm Dr. Annie Savage. Today we are going to talk about what a normal menstrual cycle is. So we're going to talk about the different hormone changes that you experience within your month and how you might feel regarding those changes within your body. If you like this video, please click the thumbs up below. Also subscribe to our channel and click the bell for notifications on a new video every week. All right, so we are going to talk about each phase of your menstrual cycle. We'll start with the menstrual phase, which is your actual period. What causes your period to begin is declining estrogen and progesterone when there is no embryo in the uterus. So nothing is implanted, you have not been impregnated, so we need to shed that uterine lining. Our hormones declining trigger this. The common symptoms that you might experience with your actual period should only be mild. They shouldn't be affecting your activities of daily living, your job, or your social calendar. Commonly, women tend to feel some mild cramping, some fatigue, and potentially headaches or food cravings. If any of these symptoms are going beyond mild and you actually need to treat them or change things in your life because of the symptoms, then we know we're looking at a disrupted hormonal balance. Your period should last between 3 and 7 days. If you have a period that's 3 days or under, you're probably thinking that you're very lucky, but this can also indicate a low hormonal levels, and we do want to check that out as well to make sure that you're ovulating and having a full cycle if you're concerned about fertility. Comment below if you're having much more extreme symptoms than the ones I just described. If you're not having mild symptoms, but you're having more moderate to severe symptoms, or you're experiencing a lot of emotional symptoms like crying, weeping, sadness, anger, irritability, lashing out, let us know in the comments below. The next phase of our cycle following our period is called the follicular phase. This is when estrogen and progesterone are still quite low, but they start to creep up. This part of the phase lasts about 7 to 10 days, and we have these hormones building at this time. This is when follicles are developing. One follicle will become the dominant follicle, which will be the egg that is released at the time of ovulation. During your follicular phase, you can feel more energetic. So your brain might be working a little bit faster, you might have more physical energy, and you might feel more creative at this time. Our next phase is ovulation. This lasts about 3 to 4 days. It's typically around day 14 of a normal cycle. If there is sperm in your system in this 3 to 4 day window when you ovulate, this is when it is possible to become pregnant. So it is actually quite a small window, but this is around the time. So ovulation plus or minus 3 to 4 days. So at the hormonal level, we have LH rising dramatically. This is what causes a surge in estrogen as well, which causes our follicle to swell and burst, releasing that egg into the fallopian tube. We also, as women, have a surge in testosterone at this time, and that causes an increase in libido. You may notice during ovulation or in this ovulatory phase that you care more about your looks, you care more about your presentation, and this is probably due to our evolution in trying to find a mate so that we can procreate at this time. Around ovulation, some women will feel an increase in energy where others will feel a decrease in energy. So that would be specific to you. Some women can also actually feel when they ovulate, they can feel the release of that egg as kind of a sharp pain in their lower left or right quadrant, depending which side your egg is released on. That's called Mittelschmerz syndrome. You might notice at this time of the month, you also get an acne outbreak. This is possibly due to that surge in testosterone. If your testosterone surge is higher than it needs to be or should be, we may see acne on the face, chest, neck, or back. From here, we move into the luteal phase. This is the second half of that cycle, and we have pretty high hormones at this time. Our estrogen is quite high, and then our progesterone is actually surging as well. The luteal phase lasts 10 to 14 days, and it's near the end of this phase where you might start to see those PMS symptoms begin before your period is meant to arrive. So again, those PMS symptoms should only be very mild and not affecting your daily life. They might be more moderate to severe where you're taking medication, taking time off work, changing your social calendar, making plan changes to support yourself. If you're experiencing symptoms like that, we need to balance your hormones. You should not be feeling down and out from your period at all. So as you can see, there's a lot going on all month for you. We have different phases and different hormones acting in different ways all month, every single month. So we do a lot better if we learned what's happening inside of our body and then begin to work with it rather than against it. So we want to balance your hormones so that you aren't experiencing symptoms all month or with your period at all. One way that we can do that is through seed cycling. We use seeds at different times of the month to support the different hormones of that phase of the month. We have a link below for seed cycling, so you can download that there. If you'd also like a quick jump start that really helps balance hormones, detoxification, and reduces your inflammation, I'll link below our 21-day cleanse. And we have this program for everybody in our office. It does really, really well. Let us know your hormonal journey below. Comment below if you've experienced mild to moderate or severe symptoms with your period, or if you've had any difficulty getting pregnant. If you like this video, click the thumbs up button, subscribe to our channel, and click the bell for notifications on a new video every week.